All right, Chapter 11, Brain Energy by Dr. Palmer.
Yes,
show your copy because you have your paperback on.
Boom.
So, Chapter 11. So we're moving through the contributing causes. What did he say that's synonymous for? He explained it 2 chapters ago that instead of I'm going to call them contributing causes.
Oh, was it?
Well, yeah, I'll look it up before we're done. So the title of this chapter, as a contributing cause, chemical imbalances, neurotransmitters, and medications.
Yeah, he kind of did a little rehash, and I was like, oh, here we go again. No offense, Dr. Palmer. But, he started doing the rehash that, mitochondria, is just, if it's not operating properly, it's a chain of dominoes and, affects all these other things. And I'm like, oh, gosh, right. Then it took a turn. It started getting a little more interesting.
Yeah. No, well, he started the chapter, I think, talking about kind of the neurotransmitters. He focused on, serotonin, GABA, dopamine, and kind of what they do, how they affect us. And kind of from there, he went into the, I don't want to say directly into, but he started getting into the psychiatric medications and how those do different things with our neurotransmitters.
It was interesting. He basically starts to say that some of the mental medications, psychiatric medications, actually inhibit some of the mitochondria
and metabolism. Yeah.
Yeah, and
appropriately so in some cases.
Right. Appropriately, and he's saying in limited cases, right, where it's almost one of these like, be careful, because if it inhibits the mitochondria, you are setting yourself up for long-term failure.
Right.
Right?
Right.
And he said, and he didn't throw out a blanket like all, psychiatric drugs are bad. He's saying they can inhibit,
by design.
Mitochondria. By design, because by design, then that lowers inflammation, it changes. So he said some of these acute issues, and it doesn't get back to drugs in general that we talk about, that drugs should be used primarily for emergent type situations, and then once you get...
Right. So he talked about hyperexcitable cells. And to your point, why are they hyperexcitable? The mitochondria is like, right? But he said that there's 2 ways to reduce symptoms of hyperexcitable cells. Number 1 is to improve the mitochondrial function. Basically the energy production, and if you remember from prior chapters, it's all about ATP and ADP, the payroll processor, and
right.
But then the second option is to manage the cells by shutting them down. And that's...
He said it'll stop the symptoms in the short run, but you could cause more long-term damage. I mean, so even improving that mitochondrial function, he's like, this is not a catch-all either. He goes, you can in fact make your problems worse. I mean, he goes, imagine a hyperactive, dysfunctional mitochondria, and all of a sudden you start to improve that scenario. That hyperactive states become even more hyperactive.
Right.
And in the short run can feel worse.
And because he alludes to that metabolism and metabolic changes take like 4 to 6 weeks, right? I think it was when he was talking about the SSRIs and how it takes SSRIs 4 to 6 weeks to start working. And lo and behold, that's how long it takes, generally speaking, for metabolic change. So yeah, I guess it's a cautionary tale, right?
Right.
That we are onto some really good things with our psychiatric medications, but we're onto some really bad things at the same time.
Right.
And
he basically blankets the question. So should people take medications that are known to impair mitochondria, yes or no? And he says, I can't offer a universal answer. He said, and you don't want to ever just stop these drugs right away. I actually had a friend of mine.
We highlighted the same thing.
Didn't we? Nice. I actually had a friend of mine from college. He committed suicide. He literally stopped his psych meds right away, and he couldn't handle it.
Wow.
And it did him in, So he throws that cautionary tale. He goes, if you are looking to enhance the mitochondria, and you know that these psych meds affect them, he said, get with your doctor and work out a plan.
Right. Without a doubt. So you highlighted the same thing I did, and he's making the point just below where you quoted. He says, suppressing mitochondrial function long-term is not a path to healing. At best, it's a path to reducing symptoms.
Right.
Makes sense. The
Doc, I can't sleep. Doc, I can't. This is right. And I loved the situation with he talked about Jane, the nurse.
Oh yeah, yeah.
You wanna?
Well, he winds up the chapter with a summing up section, right? And we can touch base on that. But then he closes the chapter with it's titled "Success Story." Jane, I'm sure it's a fake name. Agitated in the nursing home. And so I guess Jane, he was working as, what was the language he used, as a intern psychiatrist, something like that?
Yeah, some sort of behavioral therapist with them.
For this nursing home. Mm-hmm. And this patient, she was either sleeping for 12 hours at a time, or she was up, screaming. Agitated. And so he agreed to see her, and he sits down with her, I guess, in the lunch hall or the dining area, and he couldn't speak with her. She was incoherent. She didn't understand what he was saying, smearing food on herself, and his diagnosis was delirium.
Right.
And I get, long story short, she was on, I forget what he said,
5 tranquilizing medications, including 2 antipsychotics and anti-anxiety medications.
So they had drugged her up, and it started like 6 months ago.
And the initial response was that it worked.
It worked. And his theory was whatever trauma caused it to begin, she got past.
And then started affecting the mitochondria, and the situation got worse.
Yeah. So he took her. Well, he didn't take her.
He recommended
to the, I guess, the nursing home physician,
right,
that, stop as much as you can, as fast as you can. And he did. And was it 10 weeks later he's walking through there, and
I think it was like 10 days.
The lady comes up.
Long. I don't, it wasn't, I don't know how many days specifically, but her sister, I think, came up to him and
right, gave him a hug. So she asked if I was Dr. Palmer, and I said yes. She reached out and hugged me with tears in her eyes and thanked me profusely for saving her sister. I told her that she must be mistaken. I don't know her or her sister. And she told me that her sister was Jane. Turns out that for the past couple years, she had been visiting Jane 3 times a week, blah, blah, blah. She got to this point where her visits, Jane was incoherent.
Right, worthless.
And she now, how did she close it out? Blah, blah, blah.
Yeah, I think.
Well, I don't want to waste our time, but she basically said, I have
my sister back.
I have my sister back. We sit and we chat and we talk about the old days. And so she really went from this permanent state of delirium to functioning. That was the other thing. Jane's like 81, right?
Right.
So I think it'd be very easy, and I'll tell a story from my, it'd be very easy in that situation to go dementia, delirium, Alzheimer's, meds.
I cared for my aunt, and she was in a nursing home facility up in Orange City, Florida, and, the laundry list of antipsychotics that she was on, and she had Alzheimer's, and I don't blame them. And this is not a kick to the nursing homes. They have to manage a lot of people on a short budget, and they're trying to, having 15 patients up at night screaming at night is probably not a good scenario, right? So they have to use creatively some medications in order to. But what ends up happening is, like we just said, that medication works for a short period of time, and then it dips.
Right.
And then it no longer works. Like, yeah, you helped Jane go to sleep for 6 nights in a row, but then all hell broke loose.
You do it for 6 weeks in a row, and you know,
Right.
yeah. So you remember when my mother broke her ankle?
Mm-hmm.
She went into a what do you call it? Live-in rehab.
Mm-hmm.
Like she had a room and she was going to stay there for like 6 weeks. And I visited multiple times, and there was a lady 5 doors down that just yelled all the time. And of course, I reflected back on that now, and you know, this place that you go in temporarily, you do a bunch of physical therapy, you know, and eventually you get released. And I look back at that scenario now after reading this story about Jane, and I'm like, they probably had that lady zipped up on more stuff.
Yeah. Trying everything
just to get her to shut up.
Right.
And because it was driving my mom crazy. My mom was like, lady, she doesn't quit. She just yells all the time, you know? So it's kind of eye-opening. You know, he closes the last sentence of the chapter, removing the offending medications brought Jane back.
Yeah, you know, I told you I went down a little rabbit hole. I'm like, all right, if medications can affect mitochondria, what kind of other things can affect mitochondria? You know, lack of vitamin D is a big deal for, you know, for assisting mitochondria. If you're not getting sunshine, I mean, it makes sense too. Like, you know, people get depressed and you realize that they're holed up in their house and they're not moving and they're not doing, and they're not exercising and they're not out gardening or in the sun or, you know.
Dude, and we're blessed to live in the state of Florida.
Oh, yeah. I mean, we can probably get a tan today.
I've told this story before.
January 9th.
I went to a December graduation in Wisconsin years ago, and I swear, I don't mean to offend anyone who loves Wisconsin, but that place is hell.
Wisconsin in the winter.
I froze every
Green Bay Packers fan just got pissed off.
No, I have nothing against Wisconsin. I do have something against that kind of severe cold.
Bone chewing cold.
They have to like warm up their engine block before they crank their car in the morning. All right. So,
all right.
That was chapter 11, guys. I enjoyed it. It was a good one. Chapter 12, we'll move into tomorrow. It's another contributing cause. Hormones and metabolic regulators. That's going to be a big one. Yep.
All
so
right.
Thanks for tuning in. Questions, comments, concerns, hit us at snackcast@yes.fit.
Stay moving.
See you.